stakeholders in the room for those first 4. Thank you, Sharon. Welcome members and the general public to the Health Occupations and Long-Term Care Subcommittee. Really appreciate you being here and your flexibility this crossover week. We are starting our meeting at just about 12:20. We're going to try to keep it to an hour with the understanding that we might go over to like an hour and 10, 15 minutes. So that would put us at 1:45-ish as a drop dead stop time, because we have 2 other subcommittees that need to meet today since it is crossover week. So I'm going to write that down because I forget things. So drop dead 1:45. Stop. With that in mind, we have the agenda in an order to make sure that anything that absolutely needs to be out before crossover is going to be discussed first. Those are bills that maybe don't have a Senate crossfile that's come over yet. We're hoping to get as much out as possible, but we've ordered the agenda in that way. So with that in mind, let's take the 4 bills that I think are going to be pretty quick discussions first, and then we'll move on to the second 4 bills. So the first bill we're going to discuss is House Bill 600, State Board of Examiners for Audiologists, Hearing Aid Dispensers, and Speech Language Pathologists, which is Delegate Belcastro's bill, and I believe Tyler is the analyst on that one. Tyler, can you remind us about this bill?
Sure. House Bill 600 alters provisions regarding the nomination of members of the State Board of Examiners for audiologists, hearing aid dispensers, and speech language pathologists. It specifies how a licensee of the board must represent themselves in public and how they have to notify changes in contact information to the board. Requires the board to maintain and make available an electronic list of licensees, and includes in the board have provisions relating to information about courses in cultural and linguistic competency. And then lastly, it makes other technical clarifying changes.
Great. And do we have, I know Delegate Belcastro, I think is here. I think I saw her.
Hi.
Hi. Okay. Is there anything you want to add? And I see Candace is here. I'm not sure who else we have here who might want to speak on this bill, but I think everything was pretty tied up nicely on this one, right?
Everything was tied up really nicely. The biggest thing was just an amendment that we put forward to change how they do the ballot. Originally, the bill talked about a balloting process. They learned that the balloting process was going to be rather expensive, and it's an expense that the board cannot incur. So they wanted to take out that language and change how they appoint members and how they put members forward for appointment to the board.
Excellent. So does anybody want to move that amendment for us?
Move the amendment.
Second. Perfect. Moved and seconded. Any discussion of that amendment, which makes a lot of sense to me? Okay, all in favor of the amendment, say aye. And if you're going to oppose, go ahead and raise your hand. We'll give a second, but I don't see any opposition to the amendment. Anyone want to move the bill as amended?
Move the bill as amended.
Second.
Awesome. So discussion on this bill or any questions for the board rep who is here? Are we all good with the bill? Looks like there's no hands up, so I think everybody understands the bill. It's been moved and seconded. All in favor say aye. Anyone opposed? But go ahead and raise your hand. No opposition. Passes unanimously. Thank you all for your excellent work on this bill. Number 2 on our agenda would be 1193, the Certified Nursing Assistants Bill from Delegate Adams, which is also a Tyler bill. Tyler.
Bill 1193.
That's what I meant. Yeah, sorry. 1193.
House Bill 1193.
Too many numbers.
Authorizes certified nursing assistant to renew their certificate. If they normally you would have to have completed 16 hours of active practice within the previous 2 years in order to renew. But in this case, the State Board of Nursing would adopt regulations that allow a certified nursing assistant to renew if they take an approved nursing assistant training program or refresher training program, and then meet a certain number of didactic instruction hours and clinical training hours within a similar program. Any regulations will have to be consistent with federal law.
Okay, and I don't think we have Delegate Adams here, but do we have any other stakeholders who are here on this bill? I do see Delegate Saab's hand up. Is there any stakeholder here to speak on this bill? I'm not seeing any. So if you are here, just go ahead and raise your hand and I'll find you. And until then, let's hear from Delegate Saab.
Thank you, Madam Chairman. So the question is the 16 hours, is it still 16 hours, just that 16 hours somewhere else, or are the hours reduced or increased?
Let me try and double check unless someone has that information on hand. Okay, so it's not a specific hour base for the training program. It'll be as determined within the regulations that the board will adopt. So it could be whatever the approved programs end up being. They might be 16-hour courses, they might be longer or shorter. It's up to the board's discretion in their regulations.
Okay, thank you. Thank you, Madam Chairman.
Okay, are we comfortable with that, Delegate Saab? Or do you want to wait on this? I think this one, Tyler, has a Senate cross-file, right? Delegate Senator
Yep.
Eckert, I think, has the cross-file.
Yeah, and it's already moved to HGO, so
Okay,
address it if there are concerns.
let's hear from Delegate Krebs.
No, I'd just like to move the bill. I think it's important because it's going to make it easier with the workforce shortage, and he brought the bill, and I think it's not that complicated. I think we should move this bill.
Okay, I think I heard a second. Perfect. Okay, any further discussion on the bill? Excellent. All in favor, say aye. Anyone who's opposed, raise your hand. All right, passes unanimously. Great job. Let's do House Bill 1039, the State Board of Massage Therapy Examiners Bill, which I know does have an amendment. Tyler.
This bill brings in a number of updates and revisions to the current laws for applying to the State Board of Massage Therapy Examiners. It includes changes to education requirements and specifying that programs should be accredited by the Commission on Massage Therapy Accreditation, or COMTA, and it provides for changes to criminal history record checks. The amendment that is being introduced removes a mistake that came in while drafting the bill that accidentally cut language clarifying the definition of State Board of Massage Therapy Examiners. You might remember from the hearing that there was concern of folding in certain practices such as Reiki and acupuncture into the definition of massage therapy, and that was unintended. So the amendment being offered just strikes a couple brackets from the bill.
Okay, and it's a sponsor amendment, so I'll go ahead and move the amendment. Does anyone want to second it?
Second.
Perfect. And we can discuss the amendment if you need, but the intention of the amendment is to make sure, or the impact of the amendment is to make sure that those folks who were inadvertently put in the drafting or taken out in the drafting are no longer taken out. So they're fine with it, with the amendment. Is there anyone here who needs to speak on this bill? I see Amelia from the Massage Therapy Association here. Amelia, anything else you need to add?
I'm here to answer any questions, but happy to move it all along.
Perfect.
I'll
Okay.
move the bill.
Okay.
Second.
Moved and seconded. Any further discussion? I see none. Go ahead and raise your hands if you have anything to say. Perfect. Moved and seconded. All in favor, say aye. Anyone who's
Aye.
opposed, go ahead and raise your hand in the side. Looks like it passes unanimously. Excellent. We are making good time. Does anybody see Delegate Bagnall? Is she back yet? I do not see her back. Oh, I do see her. I see her. She's back. Hi, Delegate Bagnall. We'll move on to your bill, which is the Maryland Licensure of Certified Midwives Act, House Bill 758, which is also a Tyler bill.
758 establishes a licensing and regulatory system for a licensed certified midwife to practice certified midwifery under the State Board of Nursing. The State Board of Nursing will establish the standards for the practice of certified midwifery, maintain a list of all licensed certified midwives, set applicable fees, disciplinary action, and other procedural requirements. And the Board of Nursing Safe Practice Committee must evaluate licensed certified midwives who request participation in the program and report to the board the name and license number of any licensed certified midwife who is expelled from the program for failure to comply with the conditions of the program. On the request of the board, an employer must report the name and license number of each employee licensed to practice certified midwifery. And there is an amendment being introduced from the sponsor that I think might have come up during the bill hearing.
Okay. Delegate Bagnall, do you want to update us on the amendment and the bill?
So we have amended the bill to conform to the Senate. There were a couple of of amendments that were technical offered by the Senate and that were offered actually by the Board of Nursing, and then another technical clarifying amendment, which I think Robin Elliott is on this call and she can speak to the specifics of it. But there was nothing that particularly altered the bill in any way. And the stakeholders are all on board. This is a really good bill that's ready for prime time. So
Awesome. I see a question from Delegate Saab.
Thank you, Madam Chairman. So just to refresh my memory, so right now, who, I guess, oversees the midwifery or wifery or whatever you want
I
to
think
call
it's midwifery.
Midwifery.
I'm gonna go ahead and correct Tyler there.
it? Okay.
Not
I
it being
was
his
very
area of
confused.
expertise.
So who are they currently controlled under? Which board? And
Let's hear from Robin Elliott, because I bet she can answer all these questions and explain the amendments if we have need more clarification on that, since they haven't been moved yet. Go ahead, Robin.
Sure. So Robin Elliott here on behalf of the American College of Nurse Midwives. Currently, the Board of Nursing has the statutory authority to regulate two types of midwives, nurse midwives, and then direct entry midwives. This would add a third, certified midwives. They are identical in graduate education, scope, and the same exam. They come into their graduate program with a different type of degree than nursing, often some kind of health or sciences background. And so this would be a new licensure category. And the amendments are at the request of the Board of Nursing, and they simply make changes in the bill so that the statutory sort of scheme for certified midwives is exactly the same as nurse midwives.
so with the third type of license, do they do different things than the other first two?
They would do exactly, with the new type of license, they would do exactly the same thing as a nurse midwife.
So why do we need a third license if they do the same thing?
They currently do not qualify. That's a great question. They do not qualify in Maryland. They can't practice because they do not have a nursing degree prior to entering midwifery school. So
Right.
there are some at least one CM who lives in Maryland and I think commutes to another state to practice. And so that would allow this certified midwife to practice in Maryland, as well as for us to attract new midwives to Maryland.
If I can have, Madam Chairman, just one quick.
For one more.
So there's only one person that this would help. And then also you said they have some background of health. Like, can you be more specific? Because it's, I mean, do they study something specific to midwifery?
Yeah. So both good questions. So the first is we don't know the specific numbers of certified midwives that would be attracted to Maryland. We think it would be a relatively small number in the first year, but there are a number of surrounding states looking at passing similar legislation. Delaware already recognizes them. So what we're really hoping is to become a region. There are a lot of certified midwives in the Northeast. So we're looking to become a region in the Mid-Atlantic. And so that would really be where we would see the gains in the numbers of certified midwives. And then your second question about education, they must have kind of the same prerequisites in health and sciences that someone coming from a nursing program has. So if they are, if whatever their undergraduate degree didn't include something, they have to go back and take it as a prerequisite. It's fairly common for somebody to come in with some kind of health sciences background and decide that they want to go into midwifery. What this would do is that they could go into midwifery and not have to go back and get a nursing degree beforehand. So it helps because that person isn't going to take up a nursing slot in a nursing education program, and of course gets them more directly into midwifery without going back and having to get a degree that they may not really use on the
So
nursing.
Robin, this is sort of, I'm thinking of a cousin of mine who has a PhD in a hard science, who went through 2 difficult pregnancies and really enjoyed working with her nurse midwife in New Mexico, moved to Maryland, but she was interested in pursuing this exact program because, you know, mid-career, she realized how much she loved the practice of midwifery. Great science background, but in Maryland right now, that certification would not allow her to practice, but under this law, should she graduate from that program, she would be able to.
That's correct. So your friend could go into midwifery program. If there's a 1 or 2 courses she needs, she could take those. And then this bill would allow her to practice in Maryland. And so
Great.
that likely expands the number of midwives.
Delegate Bhandari.
Yeah, thank you, Madam Chair. If I understood correctly, this bill would allow for the expansion of midwifery practices in the state of Maryland, and it would provide them a path for licensure for certified midwives, correct?
Correct.
Okay, this is a good bill.
Yeah.
Thank you, Delegate.
Yes, it is.
I just want to reiterate that ACOG, you know, the obstetricians, gynecologists, the nurse midwives, everybody is supportive of this, right? Nobody has raised any red flags.
Correct. This is one of those unique bills where everybody's on the same side of it.
Super. Well, let's see if we have a motion on those amendments.
The bill.
We need to adopt the amendments first.
Move the amendments.
Move the amendments.
Okay, moved and seconded.
Second.
Any discussion on the amendments? I see, it looks like Delegate Saab has his hand up again.
I do, just quick question. So you said everybody's on board. Is everybody on board that was opposed to this bill, or are there any still
I
opposition?
don't think there was ever any opposition to this.
There was no
bill.
opposition.
I think there was.
The right to life or
Right to
something.
Life opposed it, but they didn't have a testimony, so I was just curious what.
Oh, yeah, they signed up in opposition, but then they never submitted an opposition. I think that might have been an error on that part. The subcommittee has not heard anything from them on this.
Okay. Thank you.
Sure, Delegate Krebs.
I just want to make it clear, maybe someone can answer. Maryland Right to Life did raise an objection, but they basically talked about abortion doulas, midwives, and I would just like to say on the record that this has nothing to do with that. I mean, I can't make the connection unless someone else can make that connection for me. I'm just asking, they haven't been present to state what they mean by that, but I don't see it. And keep in mind, with this midwifery, we spent years and years we have untapped need in this state. People want to do home births. I'm not one of them, but many people do. And we really have a shortage of qualified people doing midwifery, whether it's nurse midwives or just ones that are lay people that want to have the same training that they might not want a nursing degree. So I think the demand has become increased, especially as people come here from other places where this is just a routine practice. And I think Maryland was way behind, and I thank our subcommittee chair for shepherding this through a number of years ago. Now we're sort of still catching up. So I think this gets us pretty caught up. So thank you.
Okay, so the amendments have been moved and seconded. Let's adopt them, and then unless Delegate Bhandari, do you need your
Yeah,
point before we adopt the amendments?
if I've written my note correctly, this would provide birthing families more choices in selecting their healthcare provider. Is that correct,
Yes.
Yes.
Delegate Bagnall? Yeah.
Okay,
Great.
so all in favor of the amendments, say aye. Anyone who's
Aye.
opposed, put your hand up. I'm going to assume Delegate Bhandari's hand doesn't mean to be up.
Yeah. let me
Okay, so the amendments are adopted unanimously. Is there a motion on the bill?
Move the bill.
Moved and seconded. Any further discussion on the bill? Excellent. All in favor, say aye.
Aye.
Anyone
Aye.
who's opposed, go ahead and raise your hand. Looks like Delegate Saab is going to be a no on the bill. Okay. Let's move on. So it passes unanimous, but for one. And fifth bill we're going to talk about today, House Bill 915. I'm slow rolling because I know we have stakeholders to let in on these next 4 bills. Work group on Black, Latino, and other underrepresented mental health professionals. I don't know if Delegate Ampry is joining us. I do know that there was an amendment on this bill. I think, I'm trying to see if that's a Tyler bill or a Lisa bill. Okay, Lisa, why don't you give us an update?
House Bill 915 establishes the work group on Black, Latino, and other underrepresented mental health professionals. The University System of Maryland and the Maryland Department of Health will provide staffing for the work group. A member of the work group may not receive compensation, but is entitled to reimbursement for expenses under standard state travel regulations. And they will report their findings and recommendations to the governor and the General Assembly by July 1st, 2022. The amendments change references from mental health to behavioral health, add to the membership 2 to 4 representatives of organizations, networks, or associations of behavioral health professionals that are composed of and work to represent and support Black, Latino, or other underrepresented behavioral health professionals. And they authorize the work group to establish subgroups to assist the work group in carrying out its duties.
Move the amendments.
All right. Oh, were they seconded? Was that someone seconding them?
Second.
Okay, so any discussion on the amendments to this bill? I'm not seeing any hands up, so let's go ahead and take a vote on the amendments. All in favor say aye. Anyone who's opposed,
Aye.
raise your hand. I don't see any opposition to the amendments. On the bill as amended, should we discuss? Is there anybody who has anything they want to say on this bill? Delegate Saab.
A lot to say today. So just quick, I just wanted a clarification. It says other underrepresented, like who are they? Who's the other and how determined by other?
Is that a question? Do we have anyone here who's on this bill, or should we direct that question to Lisa? I don't see any stakeholders here on this bill. Where I'm looking for the language that you're referring to in other represented. Sorry, I was just pulling up the fiscal note to make sure there was no, that existing resources are used. So where
It's in the title.
It's in the title. And
the title.
It's
So I
used
think-
throughout the bill.
It's in the fiscal note too, yeah.
I think other underrepresented often can refer to rural.
No, we're talking about race. You're saying Black, Latino, and other underrepresented.
Native American, perhaps.
Delegate Saab, I know that the Secretary of Health is he is making several appointments to the membership. So I suppose that the department could be making that determination, at least for membership. And then also, I think just as the work group goes through and does its work, they'll probably be identifying these groups.
Madam Chair, I've also reached out to Marlon Amphrey to see if we can get him on the call so he can address it himself as well.
Okay, and I think that that would be great, but I don't want to hold up the bill if he can't get on the call. That would be my concern since it doesn't have a cross file. Delegate Bandari.
Yeah, I'm wondering if we could add Asian American in the other category. They're also underrepresented.
Do we know? I believe you're probably correct, but is there any data to know that they're underrepresented in the mental health field in service? Should we assume that, or?
They definitely are underrepresented, but if you need to look it up, I'm sure we could find it.
Right, but we can't just guess. I mean, I think if we're gonna
No,
pass.
I guarantee
But
you, there are not
actually, with
enough
a quick
mental health
Google,
providers.
yeah.
They're
With a quick
It's just,
Google,
we
we
know
can
that.
probably determine that. I know that I have heard that anecdotally as well, Delegate
Can we
Lewis.
wait till Delegate Amphrey comes so you can ask the question? Because I want to make sure we have all the information correctly.
We can move this to the bottom of our agenda, and I will move our hard stop on the other bills to 135 from 145. I don't want to let this one get lost since it does not have a Senate cross file. So we will hard stop on everything else at 135, and hopefully we can get Delegate Amphrey here to answer these questions. I know I spoke with him on the House floor about this bill, or on the annex floor briefly, and he gave me a pretty good background, but I would rather he be here to be able to answer these questions if possible. So we'll put this one at the bottom of the agenda, and hopefully we can get a hold of Delegate Amphrey. And until then, we will move on to bill number 6, which will take us a few minutes to discuss. House Bill 416, Healthcare Facilities, Assisted Living Programs, Memory Care, and Alzheimer's Disease Unit Regulations. I know there's a reprint in everyone's packet on this. This is a Lisa bill.
This bill requires the Maryland Department of Health to adopt regulations that establish specific standards for memory care and Alzheimer's disease units within assisted living programs. That is how the bill was originally drafted. If you look at your reprint, which starts on page 2 of the packet, It requires MDH to establish requirements specific to Alzheimer's special care units in assisted living programs that specify the number of training hours and topics for staff training and require staff sufficient to meet the needs of residents. The reprint also requires MDH to convene stakeholders to make revisions to assisted living regulations that are dated September 30th, 2016, and adopt revised regulations by December 1st, 2022. Requirements specific to Alzheimer's special.
All right, sorry, it sounded like we had a little echo going on there, but I hope the committee understood that. So this reprint, Lisa, is with sponsor amendments that are different from the Senate version, right?
Yes.
Okay.
It's where consensus, I believe that's okay to represent them as being consensus amendments of the stakeholder groups.
Okay, I think Delegate
Sponsor has
Belcastro
seen the
is,
amendments.
okay, Delegate Belcastro is still here. So why don't you give us an update, Delegate Belcastro?
Yes. So we started when the Senate, or when this bill was heard in the Senate, we started with an unfavorable from the industry, but it's evolved and we've got to a place of agreement with everyone, all the stakeholders on board. So that's a very wonderful thing. The amendments, they do strike a lot of the language from the bill as drafted, which you have a reprint so you can see that, but it leaves in the requirement that departments shall adopt regulations establishing training hours and content required for staff working in Alzheimer's special care units. It also requires staff sufficient to meet the needs of residents in Alzheimer's special care units. And the biggest part is that it's going to require that the Department of Health adopt the assisted living regulations and finalize them by December 1st, 2022. These regulations have not been updated since 2008. They were supposed to be updated every 8 years. So this is a really important thing. There's really good things in the regs right now. And we think getting these passed would really help move the needle forward for assisted living.
Okay, and I'm just looking to make sure I understand the language. So December 1st, 2022, and they will convene interested stakeholders to make revisions to the regulations that might be necessary since they were originally drafted in 2016, right?
Yep, so that 2016, September 30th, that draft is going to be the starting point.
Okay, super, really excellent work, Delegate Belcastro. Is there anybody, it looks like we have already questions from Delegate Cullison and Delegate Krebs. So Delegate Cullison.
Thank you, Madam Chair. I'm just wondering what the amendments in the Senate were and how different they made the bill.
Yep. So Delegate Cullison, when I presented the bill, I presented it with the Senate amendments. What is different is, I'm sorry, Ms. Kaufman might be able to go into the specifics, but what's different is some of the, it's really technical. It's some of the words within the staffing component, and then also making it dementia specific training. That was we just put in a couple of words to really make things more specific there. But Ms. Kaufman, I think you might have a little bit more insight when it comes to the start point for the regs. I know that you had some issues there as well, if you want to talk to that.
Sure.
Go ahead, Dana.
Okay, thank you very much. For the record, Dana Kaufman with Schwartz, Metz & Wise on behalf of Lifespan. And for the uncodified language for the regs, our initial concern was, as it was drafted, it could have been interpreted that the 2016 draft was the final draft. And we did have a concern about that because we believe that there were still issues that needed to be resolved in that draft, but also more importantly, that draft is 5 years old. So we should never be adopting a 5-year-old draft. It needs to be updated with just laws that you have passed in the last 5 years. And then of course, taking a look at it, you know, with COVID in mind and things like that. So that was the change in the uncodified. The change in the actual statutory language was more of a revision to the placement of those regs than a substantive change. And then it was just some of the, you know, it was just changed a little bit to reference the Alzheimer's special care units. We understood that the Alzheimer's Association and others wanted to make sure that the language said dementia specific training, which we agree with. So that was put in. So we are fully supportive of the bill as the industry. Thank you.
And so I'm hoping that it's not going to get caught up in a conference kind of thing. So that's what I'm trying to get at is, are we Are the bills different or is it just minor stuff that will be easily worked out?
We have been in contact with Senator Bidel as well, who was the Senate sponsor of the bill. And she is supportive, don't want to put words in her mouth, so Eric or anybody else can say it too. It's my understanding that she is, and of course Delegate Belcastro is supportive of these changes.
Thank
Thank you for that. I've been in contact with Senator Bidel directly. She wants all of these changes to be put into her bill as well.
Okay.
Perfect. That's exactly
good.
what we want to hear. Thank you, Delegate Belcastro.
Yeah,
Delegate
work on that
Krebs.
for her.
Delegate Krebs.
Thank you. First of all, thank you for putting the uncodified language in about the regs, but how do we compel that to happen? Because the regs were required to be done years ago. How is this going to require it more than what's already been required? I mean, is it tough enough? I guess it is.
So
I
that's
asked Dana that. I mean, Dana or Lisa, but Dana's been around since the very beginning. I mean, how do we compel them to do this? It's already required.
So that's a great question. There was a waiver that was, they're required to be done every 8 years. It's my understanding that for the last time around, there was a waiver that was requested and they were granted a waiver to not update the regulations at the last time that they were due. So this is gonna, we would have to wait until 2025 for those regulations to be updated. We're telling them that that's too long. We've already done the waiver. We need to do that now with this bill.
Good. I mean, I'm glad to hear that. And also, I like that you're using the baseline of 2016, at least as a starting point. But my second question is, I don't have the reprint here, but on this training, I don't have my head around the training. How do we make sure that the training is not going to be, I mean, there's lots of assisted living. Some of them don't have dementia or Alzheimer's patients. How do we make it so it doesn't drive costs? Costs in assisted living is very challenging for a lot of people. They can't afford it and it's not paid for by anyone. So how do we make sure that these training requirements are going to be targeted to where it's needed and not be a burden on and pressure on the rates?
Delegate Krebs, the language in the amendments is specific to assisted livings that have Alzheimer's special care units. So
okay,
if they didn't have that type of unit, then they wouldn't have to have that type of training.
And I believe it would be nice if we could ever come, this is not in the bill, but it'd be nice to have someone that is dementia trained, they could market it that way. This person is dementia trained, so they could offer it in place that doesn't have a unit. So I mean, I'm all for the training. I just don't want it to be so broad based, but I think, you know, obviously it's something that could be encouraged for other providers. And then they could say we're certified dementia trained, but that's just a suggestion. Thank you. I'm not asking for you to change any language.
Okay.
Not asking for any language.
Maybe next year, Delegate Krebs. We can work on something next year.
Well, and maybe the organizations themselves can come up with something that would encourage more dementia training where it's needed, not just in places with units, but
I appreciate that.
Versus mandating. Thank you.
Okay. Have we moved the amendments? Oh, I see Delegate Bandari has his hand up and Eric Colchamiro. So let's hear from Delegate Bandari and then Eric.
Yeah, Madam Chair, if you want to move the amendment, then I can.
Yeah, let's put the amendments on. So does someone want to, you can move them.
Move them.
Okay, moved and second. Okay, so all in favor of the amendments, say aye. Anyone who's opposed, put your hand up. I'm going to assume Delegate Bandari, since he moved them, doesn't mean to oppose them. And now we've adopted the amendments unanimously. Delegate Bandari, what's your question on the bill as amended?
Yeah, thank you. This is a wonderful bill because it will help access high quality, affordable healthcare, and our senior could live independently. The lack of reasonable standard for assisted living program with Alzheimer and memory care creates the risks of inconsistency in care and services for those seniors. This is a great bill. Thank you, Delegate Belcastro, for bringing this bill.
Thank you, Delegate Bandari. That's very kind of you.
All right, and let's hear also from Eric Colchamiro, who has his hand up, and any other stakeholder who has anything to add. Go ahead and put your hand up, because I think we're going to vote on this bill in a second.
First, I want to thank the bill's sponsor, Delegate Belcastro, and as well Senator Bidel in the Senate for introducing such important legislation. I also want to give a shout out to Tyler, who has staffed the Oversight Committee for the Quality of Care in Nursing Homes and Assisted Living Facilities. And also Delegate Belcastro and Delegate Kerr, who have been on that committee that did some really important work in the interim that helped further this conversation and this idea that the long-term care ombudswoman, Stevan Ellis, first put forward in some of our conversations. Just to address some of the conversation that has been mentioned, a couple of specific points. I'm really grateful that we've gotten to the point where all involved are in agreement on this. As far as some of the changes that have been made, I do want to point out that we have tweaked the language slightly so that in the Senate version, it was a staffing standard, and now it is staffing sufficient for the memory care unit. Also, to the point of cost, the cost is an important concern, and I want to always be cognizant of that. We did have a witness who testified, though, that the cost of memory care units that she pays for in Montgomery County is over $10,000 a month. So there are staffing concerns, there are cost concerns, and we have to be cognizant of the pressures on providers, especially the smaller ones. But Dr. Ney has testified that these memory care providers, and this staffing is specific to them, are typically the medium and larger providers in assisted living. And the costs are high, and we do feel that this would not be a burden to develop a standard for staffing or a sufficient staffing, however you want to put it. But really appreciate what you've said, Delegate Krebs, and pleased that we've gotten to the point with all involved to move this bill forward.
Okay, with that, I know Delegate Ampry is here now, so if someone wants to move this bill as amended, we can vote on it. Anybody? Do I have a motion?
Move the bill as
Thank
amended.
you. Moved and
Second.
seconded. Awesome. Any further discussion on this bill? Go ahead and raise your hands. Otherwise, I will call a vote. All in favor, say aye. Anybody who's opposed, go ahead and put your hand up. Looks like the bill passes unanimously. Really want to echo gratitude to the sponsor for being very patient with the stakeholders and working this out, and to the stakeholders for all coming to the table. This is obviously an issue the committee cares about a lot. So very thankful for your ability to work on this, and we will keep an eye on it. Let's see. Absolutely. So Delegate Ampry, I think we can let him in from the waiting room, and we'll go ahead and handle the questions on his bill. So I know Delegate Saab had questions, and we specifically had the question as to adding the word agent into the bill to be very specific. So let's see, is he in yet, Sharon?
I'm here.
Yeah. Hi, Delegate Ampry. I feel like I just saw you on this. So we were having a discussion of your bill, and I know that Delegate Saab had some questions. I cannot remember who else. It was Delegate Bandari. In terms of the, right now the title is Work Group on Black, Latino, and Other Underrepresented Mental Health Professionals. I think we have an understanding that particularly in the Asian community, they're also specifically underrepresented, and wondering if you would be supportive of us adding in, specifically adding an Asian to the work group.
I think that's fine. I think that, again, it's also, I'm sorry, I have like 3 meetings going on at once. I think it's also a matter of just determining the landscape over time, because right now we have an underrepresented number, and 10 years from now, certain members won't be considered underrepresented. I do understand that there is a lack of certain Asian communities within the mental health field. I'm fine with adding that. But again, it's the numbers indicate, it's underrepresented groups based on the numerical data that shows that other groups that are in need of the services aren't able to find providers that look like them or share their cultural that share their cultural or ethnic backgrounds. So I'm fine with adding Asian. I just want to make sure that there's not too much as we start thinking about underrepresented groups. Like, it's more about the cultural and ethnic and racial component, because those are certain factors that lead to certain. We understand that certain groups have been discriminated against, and they deal with certain mental health issues that are related to to those backgrounds. We want to make sure that they're getting proper representation. So that's my goal there.
Right, so I'm just looking at the directives of the work group. The work group shall identify and study the shortage of professionals who are Black, Latino, or otherwise underrepresented, assess and make recommendations, otherwise underrepresented in the mental health professions who study at an institution of higher education to be mental health professionals, underserved communities particularly. So I think that if we were to add Asian in, I don't think it would in any way limit the scope of the work group that's already well established and defined. So I think we already did adopt your other amendments. So the committee was good with that.
Madam
I
Chairman.
think Asian, I think even I think the goal here is to understand like what, again, with equity drives all of my policy. And we've got to understand is who is being the most, who's receiving the least amount of care, who's suffering the most from mental health issues. And it's currently it's the Black and brown communities that are suffering the most. But I understand that there are other groups that also are in line there. They are underrepresented as well. So I'm happy to add Asian, even maybe we can consider adding Native American. But I think that, it's important that we don't, that we don't lose sight of ensuring that the people who are in most need should get the most support and help.
So I'm gonna, is Delegate Lewis still on, because she had some thoughts on this. I'd hate to cold call on her, but she does have a great public health background, so she may have some something to add. I'm not sure if she's still on. It looks like she's not here as I'm calling on her. So let's hear from Delegate Saab.
Thank you, Madam Chairman. I had a simple question, and I'm not trying, I think Delegate made it clear that he wants to concentrate on specific population, which I also think, this study should, because that's what this study is about. I'm not sure if we add more people, if it's going to dilute what his intentions were. My question was, when he said in other underrepresented, like what was the intention by adding that? Was it? The intention is Black and Latino, and I don't want to add, every single other race, because maybe we can have other bills for that, but you're adding more people is going to broaden the intent, I think, if I'm correct.
Yeah, I think that's you hit the nail on the head there. The goal here is, the goal here is to thinking about the people that are mostly in my district, and thinking about people across the state of Maryland who are in need of mental health care and social services. You look at here in Baltimore City, I think over 96% of our student population is Black, but only I think like less than 12% of our school therapists are Black, right? So it just doesn't make sense. We got to figure out a way to get more opportunities for people of color to join. And I don't want I don't want to make it too broad, but the reason I had other underrepresented groups was to make sure that we're not overlooking groups that are also in other areas of Maryland that I'm just not as aware of, that I know are also in need, right? So I just didn't want to make sure that we didn't exclude certain groups such as our Native Americans, Asian, those are the kind of groups I was thinking about when I said other underrepresented groups.
Well, and Delegate Ampry, I think, I know there's a large, for example, Filipina community, which is Asian, but certainly underrepresented and have unique challenges.
Exactly.
Okay, let's hear from Delegate Bandari, then Delegate Riley, then Delegate Morgan. Delegate Bandari.
Thank you, Delegate Marlin, for accepting that amendment aiding Asian Americans, because I'm not a healthcare professional, but I have seen this this problem, the committing suicide within Asian American community, not telling anybody, because of the cultural differences, they are introvert. And so thank you so much for that.
Okay, Delegate Riley.
Thank you, Madam Chair. I was just wondering, a question for the delegate. Since the bill hearing, have you spoken with the Behavioral Health Administration? Because according to a letter that they sent to us during the bill hearing, we just want to make sure that your bill and what they're currently doing is not duplicating services.
Yeah, they said that this will actually support their services. Like the goal, what could come out of this study could actually help them. So I think it's not duplicative at all. I think more so it's a supportive piece of legislation that hopefully be able to help them do what they're doing even better.
Okay, so what they're doing currently with the Maryland Historical Black Colleges and their work groups, they've spoken to you and you're going to work together. That's awesome.
Yeah. So I would say I haven't spoken with them directly, but a letter that they sent over was saying that this work group would be supportive of what their work is. So it's not that there would be the conflict. They were supportive in that this will actually support what they're doing. So they wouldn't. I agree. We don't want to duplicate things. There's more money that we're duplicating. This is not be duplicative at all. It'll be supportive.
Excellent. Thank you very much.
Question from
Thanks for the
Delegate
bill.
Morgan.
Hey, thank you, Madam Chair. I was just going to propose, instead of drawing a line with numerous ethnic groups, wouldn't it be better, or haven't we done this before in other legislation, drawing a line at certain poverty level?
I would disagree, because there's not again, when we're talking about mental health care, this isn't a issue of discrimination. So I'll look at it like this. The poverty component of it isn't as much worrisome for me, because if you are a white woman and you are poor and you want to go find a therapist, you can find another white woman with ease. You're not going to struggle to find a white woman or a white man to serve you. Whereas if you are a Black woman and you are dealing with mental health issues and it's related to trauma that you are dealing with as being African American in a world that is very, unfortunately, we still live in a world where racism is very prevalent. It's going to be harder for you to find someone that's going to be able to connect with you and where you feel open and honest and being able to share. I do think that we need more culturally competent mental health providers. I think that it goes beyond race isn't the only thing that's going to connect you. It's important that people are culturally competent. It goes beyond just the racial connection or ethnic or cultural connection. But there's not really a dilemma or issue where people are not able to find a social worker or a mental health provider that shares their socioeconomic background. That's not a connecting point that is as worrisome for me as it is race, cultural, and ethnic background.
That answer your question, Delegate Morgan?
Well, it actually probably brought up about 20 more questions. I mean, it's basically, isn't that like the study of segregation?
No, it's not the study of segregation.
You're basically saying that one group will only go to another group if they're the same ethnic group.
So I'll disagree with you there, because I'll keep it very blunt with you. Black people need more mental health because of segregation, right? So
no, don't misinterpret what I just said.
Okay, go ahead.
You basically just said that African Americans will only see and seek mental health other African Americans, and I just
no. So it's not their only secret. It's just that there is data and scientific evidence that shows that when they're able to meet with a mental health provider that shares their cultural and ethnic backgrounds, they're more willing to reveal the issues that they're having. So if let's say you're dealing with racism or microaggressions at work, and you want to talk to a therapist about that, and you have let's say if you're a Latina woman, a person of color, and you're having a issue with a supervisor at your job who's giving you microaggressions, who's making fun of your culture, who's making fun of your accent, if you then go sit with a therapist who is of the same, who comes from the same background as your supervisor, there's no reason as to why that person still can't connect with you. But data shows that the person who's dealing with the microaggressions is less likely to be fully revealing of the issues that they're facing. And what happens is, if we're not able to sit into a room and be more revealing and be able to really open up about the issue that you're having, in order to really dig and get into the root cause of why you are suffering from certain mental health issues, or why you're dealing with certain things at work. It's just, the data just shows that when people share the same ethnic, cultural backgrounds as the person that they're meeting with, there's data that shows that they're more likely to come back for more help. They're more likely to stick through the process. And that's the goal of this bill. It's not to say that one group can't help another group. It's just that the data shows that one group has shown to be more effective, and that it leads to groups that have decided not to go into mental health services are willing to start doing it when they start seeing people who look like them in the field. And that's all we're trying to do here, is figure out how we can diversify the field.
Okay, well, I appreciate you answering the question. Thank you, Madam Chair.
No problem.
Absolutely. And Delegate Morgan, I have to say, this has been a really compelling storyline on This Is Us the last season. So I encourage you to watch it. It's really resonated for a lot of us white folks who can't quite understand the experiences of people of color. Delegate Saab.
Thank you, Madam Chairman. Just to add what Delegate Ampre had said, and I agree that I think a lot of it, I think it's just not what people look like. It's just having the similar in culture. Whether you look the same or you don't, you have a lot more things that you can relate to if you're born in, a certain part of the world, or if you've had the same, similar upbringing. So again, my question is, I just want to make sure that we don't broaden it too much, so it gets too diluted, so it misses the
right
impact of the bill. So adding more people, yeah, obviously Asians might be, another group that need something like this. But I guess maybe we should just remove under or add underrepresented, just because it creates some confusion. That's all.
No, I understand that. I just want to make sure that the work group, whatever they come up with, can be applied to other groups as well. And that's kind of the vision that I had for a while. I wanted to make sure we included other underrepresented. I'm sure a lot of the findings that they have, what we can do to increase access to people joining the field, will be applicable to more than just Black and brown people. I think it can be applicable to multiple groups. So I just want to make sure that we're not that we're including that research, and that we're able to get solutions for more people. But I agree, narrowing it is important and not expanding it too much. So I appreciate your comments and your feedback.
Delegate Lewis, I see that you are back at the top of the discussion. We were sort of continuing the points that you were making earlier. I don't know if there's anything that you wanted to add. I think Delegate Ampre was comfortable with us adding in Asian. Delegate Bandari was appreciative. So I don't know if there's anything else you needed to add to this conversation before we vote on the bill. Or, sorry, Delegate Lewis has multiple subcommittees meetings, so she's been in and out, but I know she's very interested in this conversation and very supportive of this bill and thinks it's a great idea. So
Move the bill.
Okay, now did we vote on the amendment in concept? We adopted the sponsors amendments, but if we want to add the word Asian in, we need to really clarify exactly what we want to put in. Anybody?
Move the amendment.
So the amendment, just so I'm clear, is going to add the word Asian before underrepresented in the title. And then I would suggest also add the word Asian in places where Black and Latino are listed, with the exception of the place where it says, I guess we could say or Asian, the hospital's language. I just want to make sure, we're getting one representative each from at least 3 different hospital networks in the state that primarily serve Black, Latino, or Asian communities, I guess would be the language. I just want to make sure that I'm not sure we have any hospitals that primarily serve Asians only. I just want to make sure that the language is inclusive. Delegate Bagnall.
Thank you, Madam Chair. Would it be Asian and Pacific Islander, or do we need to be that specific?
I would suggest AAPI, Asian American Pacific Islander. So that would be broadly include a lot of
broadly inclusive. Okay, thank you.
Okay, great suggestion, Delegate Bagnall. So we have the amendment in concept, which has been.
Hold on just a second, Delegate Bandari. So what is the wording again?
AAPI, Asian American Pacific Islander. I can text you or send you an email.
Okay, I just want to make sure I get it exactly.
Wonderful.
No, thank you, Lisa. Okay, so that is our amendment in concept. All in favor of that amendment? It's been moved and seconded. All in favor of that amendment, say aye. Anyone who's opposed, raise your hand. I'm going to give you a second to raise your hands, but it looks like that amendment is passing unanimously. Do we have a motion on the bill as amended?
I moved the bill.
Second.
Moved and seconded. Any further discussion on the bill as amended? I see no hands up. So all in favor of the bill as amended, say aye.
Aye.
Anybody who would like to oppose it, go ahead and raise your hand. I'll give you a second to oppose or to put your hand up, but looks like everybody thinks this is a great.
Chairman, I have a question. I mean, I guess
yeah,
we're voting. Thank you. So adding those groups, is it going to increase?
It's not going to increase the size. No, I was checking on you for that. It's going to make sure that in the conversation that they're having, the stakeholders are including conversation about these underrepresented Asian communities, but the size of the work group won't increase.
Thank you.
Absolutely. So with that, it looks like the bill passes unanimously. Thank you so much. Great job. Where are we? We finished Delegate Belcastro's bill? Thank goodness. Okay, so we will move to House Bill 299, the Genetic Counselors Bill, which is a Tyler bill, and I think we have an amendment from the Senate on that one.
Yes, so that was sent out just a few minutes before this meeting started. If you want to look there, it was Senate Bill 34, and then we have it now that the sponsor intends to make conforming changes to match it. So that House Bill 299, State Board of Physicians, Genetic Counselors Licensing. And the purpose of the bill is that it would require the State Board of Physicians to begin licensing genetic counselors and bring in requisite regulations and policies for overseeing this practice. The amendment brings in changes to board composition, expanding the size of a certain board with working on the genetic counselor issues, and then also brings in the issue of supervised practicing genetic counselors, which is effectively mirroring trainee or limited practice.
We got a couple more bills.
Making sure that you see in most of the other boards at the present. So that's the main work of the amendment, and then technical changes and retabulation as needed after bringing in those new provisions for those in training.
All right, I see Matt from the Board of Physicians here. Delegate Carr, do you have anything to add? And then we'll talk to Matt.
Yes, so yeah, this bill, the cross-file of this bill, Senate Bill 34, did pass the Senate unanimously. My understanding, hopefully Matt will read this, from the Senate sponsor, is that it passed with the approval of the Board of Physicians with the amendments that were made on the Senate side. I see Matt nodding. Anyway, the idea is to conform this bill to the bill that passed the Senate.
Excellent. And so in addition to Matt, is there anyone else here that we need to hear from? Raise your hand in the sidebar. Margot. Okay. So let's hear from Matt, then we'll hear from Margot. Matt.
Good afternoon. I just want to echo what the delegate said, and also thank the advocates for this bill. We've been working with them quite a lot, and did come up with these amendments. I'm happy to answer questions on any of them. We are, I think, we've come a long way, and these address the core issues that we have with the bill.
Glad to hear that, and you've definitely come a long way. I'm so appreciative. Margot.
I just want to say I'm here for questions as well. And I also want to thank the Board of Physicians as well as Delegate Carr for all of the hard work and moving this forward so we could come to a consensus.
All right. Do we have questions from the committee? I'm giving folks time to raise their hands, but it looks like I'm not seeing any questions. So maybe someone from the committee could move the amendments.
Move the amendments, Madam Chair.
Second.
Awesome. A question from Delegate Saab.
Thank you. Just a quick question. Education-wise, how long do they go to school, genetic counselors?
We go to school for, we have a master's in science in genetic counseling specifically. So it is a terminal degree. And then we also have to pass a certification exam in order to be a board certified genetic counselor, which has to be done within 5 years.
Perfect. Thank you so much. I appreciate it.
All right. So the amendments have been moved and seconded. All in favor of the amendments, say aye. Anyone who's opposed, raise your hand in the side. Looks like it's unanimous. Do I have a motion on the bill as amended?
Move the bills amended.
Second.
Moved and seconded. Any further discussion on this bill? I will just say again, we really love it on HGO when people come together and work out their problems. So great job to the sponsor. Great job to the advocates. We appreciate it. All in favor of the bill, say aye. Anyone who's opposed, raise your hand in the side. Looks like it's passing unanimously. Great job. Final bill of the day, House Bill 652. This is the bill we discussed last week. Also a Lisa bill. This is the Residential Service Agencies Guidance and Reporting Bill.
So nothing has changed since we discussed this on Monday. The bill still requires the Office of the Attorney General in consultation with the Maryland Department of Health and the Maryland Department of Labor to produce a guidance document concerning the application of employee protection laws to the employment of personal care aides by residential service agencies. The document must be completed by December 30th, 2021 and revised and updated each year. And as a condition of licensure, an employee of the RSA with authority over pay and employment practices is required to certify that they have read and understood the document and that RSA will comply with relevant requirements of the labor and employment article. As was on Monday, there are 2 sets of amendments in your packet on pages 7 and 8. Both packets of amendments have, they both clarify that the certification is required as a condition of the initial license and every 3 years thereafter. Then the amendment on page 2 also strikes language requiring an RSA to report to MDH on whether it classifies personal care aides as an employee or contractor and the hourly pay rate.
Thank you, Lisa. And thanks for remembering we discussed this on Monday. It seems like months ago. So I know that when we discussed this on Monday, Delegate Krebs had to leave the meeting. So I'm glad to see that she is here now. I don't even know where to start with this conversation. Do we have, well, so we have stakeholders here. I will say that while nothing has changed in the conversation, I know that subcommittee members have been hearing a lot on this bill. I've heard from a number of members of the committee who have some outstanding questions and also concerns about the idea of striking the reporting, other subcommittee members who have concerns about maintaining the reporting. So I'm surprised there's no hands up. There we go. We have Delegate Krebs and then Delegate Saab.
Well, I've asked this question, I guess, at the committee hearing, and I still don't know. My main question is, what is the problem we're trying to solve? You know, what is the problem? Does this solve it? And what is the cost to business for complying? I mean, what is it we're trying to get? Because I mean, answer that question first.
Okay, so I guess that would be a question for David, probably.
Thanks. And I just want to say I really appreciate all the questions from members of the subcommittee and all the sort of thoughtful discussion and really digging into the issue. So the problem that this bill is trying to solve is that we have a home care workforce crisis in Maryland, which has 2 components. We don't have enough home care workers, and the turnover is off the charts because the job quality is so poor. The bill seeks to solve that problem in 2 ways. First, it seeks to reduce the misclassification of home care aides as independent contractors, which is a huge issue for job quality, through the guidance document that we've talked about quite a bit. And second, it seeks to provide more accurate information to policymakers about what sort of aspects of the job quality are, and the maybe most important one is pay rate. So these workers, 90% of whom are women, 70% people of color, are getting paid very low wages, but the state isn't tracking what the RSAs are paying them with state money, with Medicaid money. You've got written testimony from the Caroline Center, a really fantastic organization that trains women from disadvantaged backgrounds to get CNA, GNA certifications, explaining that graduates of their program are moving from home care to Amazon and fast food once they get into home care jobs because they see what those jobs are like. So that's sort of the problem that the bill is trying to solve is improving job quality, both by reducing misclassification and getting to policymakers better information about how state money is being spent so that we can have a sort of more comprehensive approach towards improving job quality, reduce turnover. And I just want to mention with regard to turnover, it can be really traumatic for people receiving care. And again, we're talking mostly about Medicaid recipients because the care we're talking about can include toileting, bathing, grooming. It's extremely intimate. And when you have a constantly rotating group of workers, it's really, really bad for health outcomes, and it can be traumatic in terms of mental health. So that's the problem that the bill is trying to solve in those 2 ways.
Can I ask a follow-up to Delegate Krebs' question? So I get the idea of improving the job quality, reducing turnover, reducing misclassification. on the pay rate issue, how does, we have certain rates. Is the issue that we have sort of two competing models for using those Medicaid rates and that we're trying to dig into that? Or how do we see having this data help us increase pay rates?
Right. Well, so the idea there is just the state doesn't know, policymakers don't know. What we do know is what the Medicaid reimbursement rate is. Right now it's $19.50. There's no data tracking whatsoever about how much those RSAs that receive Medicaid funds are paying their workers. And if we're trying to sort of comprehensively solve this workforce crisis, you can't do it without sort of accurate, up-to-date data about what sort of the basic terms and conditions of employment are, and classification and pay rate are the two most basic conditions. So it's just about getting the accurate information to policymakers so that we can have a sort of longer term approach to, well, let's fix this problem. We've got this massive problem. It's affecting workers. It's affecting disadvantaged communities. It's affecting consumers. And let's just learn about it so that we can have an educated approach towards fixing it that really does, it's not burdensome, I don't think. So that's the approach of the bill.
So is the thought that it's possible that the RSAs that use an employee-based model are passing more of that $19.50 onto their employees than the RSAs that use a contractor-based model? Is that?
We don't know, and I would say the purpose of the pay reporting isn't necessarily just to see. I mean, I think that's one of the components of it. What's the pay differential if you have RSAs that are classifying workers as employees versus independent contractors? But that's not the only one. Really, it's just we have this massive workforce. We're talking about something around 30,000 home care workers in Maryland, just spread across the whole state, and they're funded with state money. And we don't know how much they're being paid with that state money. And they're 90% women and 70% people of color. And in other industries where you have a state funded workforce, like with the prevailing wage, we're talking about construction, predominantly male dominated fields of work, you do have very detailed reporting, bi-weekly submission of certified payroll reports to the state. Here, where it's mostly women, mostly people of color, we're just sort of ignoring how state money is being spent, and it's hurting workers and hurting communities and hurting consumers. So that's the idea, is let's just get the information out, and then with that information, we can look at it. Maybe we'll discover things that we haven't yet thought of to fix the problem.
Okay, so I'm going to pivot. I know we have questions from Delegate Saab.
I didn't finish my question.
Okay, if it's okay with you, Delegate Krebs, I'm going to have, since people are confused about this, I want to make sure Dana Kaufman has a chance to respond to those things that were said, and then we'll go back to the second part of your question. Okay, Dana?
Thank you very much. I think one of the biggest issues that isn't being discussed but needs to be discussed is the fact is we're saying that they're not, the pay is not high enough. Well, that's because Medicaid underfunds the entire program. And that's not even based on what the home care agencies are saying. That's based on the study that was required by this committee in 2018 by Hilltop Institute, which showed that the program was severely underfunded. It did not cover, the reimbursement does not cover the cost to provide care. Building on that, the budget committees then told the health department that they needed to develop a 5-year plan for increasing that reimbursement. And that was 2 years ago, and we still don't have a plan or any increases. And during the COVID-19 pandemic, the home care services received no federal or state aid either. So if you're trying to increase reimbursement, you have to look at what the Medicaid program is reimbursing. That is probably the biggest issue that we have right now, because that $19.50, that does not go to just the wage for that personal care aide. That covers the entire cost of the program, including the salary for the RN that must supervise and all of the administrative costs. So if we really want to look and do something about this, then we've got to take that challenge on. And that's the bigger challenge. Now for here, I think it's also important to note that the Maryland Department of Labor, there is oversight here. The Maryland Department of Labor has gone to agencies who use independent contractors and has given them information on the differences and the W-2s versus independent contractors. And yes, it is more expensive to have W-2 employees than independent contractors, but that also goes back to the Medicaid reimbursement. So I don't want that to get lost here, because it's almost like we're saying that if we get this information, we can solve low wages, and that's absolutely not true. We have to take on the low Medicaid reimbursement. So I just don't want that point to be lost in this discussion.
So we have a lot of hands up now. I knew we were going to get there. I think I just want to reiterate something important I heard Dana say, because I'm sure that this committee is in support of the idea of working, in a strategic way to do what we can to increase these rates. I'm seeing a lot of heads nodding. So we need to think thoughtfully about what that path might be. We'll go to Delegate, let me just read out the order because there's a lot going on. We'll go to Delegate Krebs. I see that Delegate Chi also has her hand up. So after Delegate Krebs, we'll hear from the sponsor of the bill, then we'll go back to Delegate Bagnall, Saab, etc. So Delegate Krebs.
No, thank you, Dana, for pointing out the obvious. I mean, right now, the law already covers misclassification, and there are penalties and repayments. We have that in law already. We've had it for years and years. I don't see, whoever just spoke before me, the issues that you brought up are real issues: turnover, improving quality, pay rates, workforce shortage. But this bill does not help with any of those things, I don't see. And that's the problem. I don't see the connection between what you said the problems are and what this bill does. So that's my concern. Is just, even when we get this information, we sort of know the answers. So I don't know what really good we're doing here. So I understand the problem of workforce shortage, but I do not understand this bill and how it does anything except cause a lot of paperwork and bureaucracy of collecting the paperwork.
All right, let's hear from Delegate Chi.
Thank you, Madam Chair, and thank you for your very deliberate, thoughtful discussion. I wanted to respond to Ms. Kaufman's earlier point. I think if we already know whether with data or not, that reimbursement rate is an issue that we should tackle, then if I were in your shoes, I would advocate for collecting more information to push for changes in that direction. Why wouldn't you? I would turn the question around and ask you, why wouldn't you want to collect more data to show that some small businesses actually have to resort to classifying people as contractors, maybe to stay afloat because of the extremely low reimbursement rate? So it would be a super good argument for you, right? So I don't know what we are hiding here. Now, if I were a government giving money to businesses, why wouldn't I want to know how they are spending the money? It is my responsibility to know. So if we're going to collect information anyway, let's just collect the information. And what are we afraid of collecting? That's my point. It is the state's responsibility to address a social issue that is going to be exacerbated as we all grow older, and as a public health crisis shows how much more we need to rely on this forgotten and oftentimes just totally overlooked workforce until we. So, I think we're doing a lot of good here by just collecting information without being too heavy-handed and presuming any wrongdoing here. So, I just want to point out the obvious here.
Thank you, Delegate Chi. I want to make sure we have Alex Petchov in from the waiting room, because I know he wanted to be part of this conversation too. So I'm just making sure my staff knows to let him in.
Yes, I'm here.
Oh, wonderful. Thank you. I'm glad you're here. So let's hear next from Delegate Bagnall, and then Delegate Saab, then Delegate Charles, then Delegate Bandari, Michael Bullis. I think maybe we'll get to you too, of course. A lot of people are interested in this topic. Delegate Bagnall.
Thank you, Madam Chair. And I want to thank the bill sponsor for bringing this forward, because out of this discussion, some of us have learned that this is a relatively unregulated space, which I think is of huge concern, to this committee. I want to reiterate some of what we've heard from other committee members, what we thought we were hearing in the hearing, what the bill did, and what we heard in the subcommittee. What the priority of the sponsor were quite different. So I think we're all trying to wrap our heads around the problem that we're trying to solve and how best to solve it. And I think for me, some of the challenges, I almost feel like we're not doing a deep enough dive. To Ms. Kaufman's point, if we don't have information across the entire spectrum of these residential services, we don't have a way to identify where the problems lie. We know that there's a workforce issue. We know that there's a reimbursement issue and a pay rate issue, but where is that in the chain of this space? So, I don't know how we solve that. And I don't know if it's with this bill or if it's amending the bill or to Delegate Chee's point, she said, we're trying to not be, too heavy-handed. In some ways, I think given the challenges, we might need to be more heavy-handed because it is concerning that we have a health space that seems to be wholly unregulated. And I don't know if this bill gets us there, but maybe we can find a way to use it as a mechanism to get us there.
Thank you, Delegate Bagnell. Delegate Saab.
Thank you. Sorry.
Sorry, chewing.
Sorry, yeah, I wasn't sure it was going to be that fast, but a few points I want to make. I think Delegate Krebs addressed a couple of things. Number one is the IRS is pretty specific on the classification between an independent contractor and an employee. And the penalty that comes with it, it could be devastating for small businesses if they break that law. That's number one. Number two, I don't think we need to regulate. I think it's a supply and demand. And the reason for the turnover is not because of rate. It's a hard job that people have to do. It's not an easy job. So people do it because they like to help other people, but at some point they burn out because it's a tough job. So not really one of the reasons that we have shortage is not of the pay rate. Matter of fact, if you go online and look at ZipRecruiter, you see people are offering bonuses for people to come in and work. And I think this bill will do absolutely nothing. All it will do, if we create more regulations toward this business, the cost will go up. And then the quality of service that we provide to those needy elderly or people that need the care is going to decline. Because at some point, when the Medicaid rates don't go up, the quality of service will decline. So, obviously I understand the intention of this bill. I just think it's very intrusive. Finding out what the rate says is not going to change a thing. And it's going to lead to not only not having employees, it's going to lead to lower quality in the workforce. So, I mean, it's more of a statement. It's not a question.
And can I ask you a clarification, Delegate Saab? Because I think you and Delegate Krebs both have said this bill, but are you okay with the parts of the bill that there is unanimous consent on in terms of the notice? There's a lot of work done to agree upon the notice. Are you okay with that part, or you are not okay with the whole bill?
The notice to tell them that there's two different ways that we can pay you. Mm-hmm. One way, here's another way. Again, every legitimate business have the responsibility. I mean, I'm okay with it. It doesn't really add or change anything. My biggest problem is the reporting. It's that intrusion into some business. And like Dana mentioned, there's a lot more expenses that comes with, paying somebody with a contract. There's a lot of back end stuff that be done. But yes, I mean, if you want to just inform them, I don't think it does that much harm. Again, it doesn't really benefit the whole bill, but it'll be just, a feel good bill more than anything. But yes, I'm fine with that. I'm just not fine with the reporting part.
Okay, as I mentioned, there are a number of delegates with their hands up, and I want to get to all of them, but we do also have a hard stop at 1:45, which is in 5 minutes. And we haven't yet heard from Alex Petrukov, who I know was here to answer questions from the perspective of an RSA that does use contractors. I see Dana Kaufman's hand up, I see Dave Rodwin's hand up, and Michael Bullis's hand up. So I want to use these last 4 minutes now very thoughtfully. Dana Kaufman's hand is down. So Alex, did you have anything that you want to add to this conversation? Because we are clearly going to be discussing this bill again next week. I hate to make you come back, but you probably have some insight for our committee members in terms of the business model and where you see this issue as.
Sure. Thank you for letting me come in. Definitely. So we're an RSA that has been around since 2002. We're kind of medium size, I would say, to smaller size. We're family owned and operated. And we started out in 2002 using 1099 contractors and have remained that way with definitely pressures from different angles. I just want to, Delegate Saab was mentioning oversight, and we have a lot of oversight. We're an agency that essentially reports to Maryland Health Department, right? So we're audited by the Department of Health constantly, right? Medicaid keeps us under really a close eye. We've gotten directives from the Department of Labor as well, and have guidance, the FSLA Act, on fair practices when it comes to labor. And so we're, between a rock and a hard place. The reimbursement rates, as you know, are low, and if we're forced to go to W-2, we kind of become less profitable, almost not profitable at this point. Our main function is in Montgomery County, where the rates keep going up, as I'm sure everybody knows, the minimum wage rate. And when the contractors, at least in our organization, when the workers want to come and work for us, we explain to them clearly what they're getting themselves into. We sit down and we tell them what a 1099 contractor job looks like versus a W-2. We let them know the advantages and disadvantages. Now, as you know, caregivers are hard to find, it was mentioned. The caregivers have lots of agencies to pick from to go to work for. And I'll tell you, 90% of the people want to do 1099. They call us, they ask us up front, what do you guys pay? 1099 or W-2? People want money in their pocket now. They don't want to have X amount of percent gone from their check without even seeing it, in hopes to get some of it back during tax season. They want it back right away. And then, when it comes to tax season, contractors have certain things they can write off. They go see their accountant. Transportation is one of the items that can be written off. And there's other fees and other costs associated now. So I'll stop talking. I'm sure you guys have questions. I can answer anything else you need. Thanks.
Thank you very much. And we're going to end the meeting in just a couple minutes. I want to get to Delegate Charles because his hand has been up forever. Delegate Charles.
Thank you, Madam Chair. And I'll try to keep it real short, because I'm a true supporter of small business, Alex, and I want to figure out a way that we can help you guys. But at the same time, I'm interested to really understand how much profit you guys are making in comparison to the salary, because this becomes a big issue that Delegate Chia has brought up. And that's why this reporting requirement is so important, because we're looking at minority communities. We're looking at women who are being disproportionately paid lower amounts of money. So having a better and clear understanding of what that profit difference is to how much money they're actually paying for 1099 employees to W-2 employees. Because the bigger picture is, like also Delegate Saab mentioned, it's a hard job. It's a very hard job, and people need to be paid appropriately for this hard job. And we just want to make sure there's some fairness across this unregulated industry.
Sure. I mean, I can, I don't know if you want profit margins or end of the year profits, but I'll tell you up front, we are one of the highest paying agencies per hour in Maryland. So we're paying $15 an hour to caregivers, most of whom are very little educated, right? They immigrants, right? And only thing they have to do is criminal background checks. They have to do certifications, first aid CPR certifications, and certain other health certifications, and can make a decent living. Medicaid reimbursements, as you know, have just trended up a little bit, but for the most part, the margins were very low for a very long time. But I can probably provide some reports to you guys if you'd like to see them.
Does that answer your question, Delegate Charles?
Yes, Madam Chair, I'd love to see some of those reports. I think it'll help us make some better judgment calls on how we move forward.
Excellent. Okay, it is 1:46. I see Michael Bullis and David Rodwin's hand up. Let's hear very briefly from Michael Bullis, and Dave, I will tell you, we're going to talk about this next week. So I'm sorry, but Insurance Subcommittee really needs to meet. Michael.
I can come back next week as well, if you like. I really feel it's important as somebody who watches people every day who need significant care. It's an epidemic out there of people working as not as employees, buying their own PPE, being paid $9.50, $10 an hour in wages, and then being told you're a contractor, you have to take care of everything. It's a disgrace. I put in the chat box that Maryland's own fraud task force found in 2018 that and they only audited 1,400 employees and found $50 million in undeclared taxes for people. So it is a real problem. And I'm frankly not offended by the idea of monitoring these folks and making people pay attention to the actual law, because if we don't do it, it's not enforced by the IRS. I get tired of hearing people say the IRS will take care of this. No, they don't. It's the state that actually does it. If anyone does it at all, DLLR does it some, but that's about it. And you usually have to get reported in order to deal with it. So that's all. We really have a lot of very vulnerable people out there who need this kind of care, and they don't need to have employees who are terrified of what's going to happen next for them and whether or not they're going to have a job next week and how they're going to get paid.
Thank you. Okay, I have a hand up from Delegate Saab, even though we need to leave. I'll let you go ahead quick. Go ahead.
Just a quick question. I have actually a question to Mr. Bullis. Do you own a business?
I don't right now, but I have over the last 40 years owned several, yes.
And did you pay your employees the 1099? Did you obey with the IRS?
I did. I very seldom ever use 990s. I've always, excuse me, not 990s, 1099s, but I've always treated my employees as employees because my dad worked for the IRS, so he taught me young.
Right, but I'm saying the point is that you should know that the IRS is very strict on those rules.
But they don't enforce them unless they get reported.
Yes, they do. They do enforce
Madam
them.
Chair, point of order. Are we still on the bill?
Well, it is on the bill. It is on the bill.
Yeah,
all right, well,
he and I just disagree.
Okay, so what we have is a bill before us where there's consensus on part of it, and there's a question as to whether we move forward with the amendments or not to strike the reporting or maintain the reporting. We do have the Senate bill that has come over already, so we can continue this discussion after crossover as necessary. It sounds like there are a lot of folks still trying to get their mind wrapped around this and process the information that we received today. So we will pick up this conversation at our next meeting. Is there anything else from a member in closing, or anything any member needs before the next conversation on this? We have some outstanding questions, I know, from Delegate Charles, sort of on what kind of profits we're talking about. Anybody else need anything from the stakeholders involved in this conversation before we next come to discuss this?
Can you just tell me what the Senate bill number was? So I can look it up.
384. Sorry.
Thank you, Dave. Thank you very much, David. Okay, so we will continue this discussion next week rather than rush a decision that the committee is not ready for, but we are not done discussing this topic this session. Thank you all so much. And with that, Delegate Culleton, please.
Thank you very much.
Madam Chair.
Yes, please tell us what's your plan.
I would like the overlapping members with the insurance subcommittee to have a moment to just stand and stretch. So we will begin our work at 2:00. So
excellent.
For insurance subcommittee at 2:00. Thank you.
Thank you for your consideration, Delegate Culleton.
Thank you.
And
all
thanks
the
to
good
the
work you
staff
did.
for handling everything this meeting. Really appreciate it. And all the